right heart margin is the middle, right middle lobe. The right diaphragm is the right lower lobe.
Can you say that one more time?
The right diaphragm is the right lower lobe. And it's tough to, there's nothing really that blurs out too much for the right upper lobe, but you usually can see the fissure sometimes. But, okay?
So home. We talked about all that.
You have to use the lateral to confirm it because it's not 100%. Okay? I just told you all that stuff. Okay, so it can be, what is it? What could it be? Well, it can be a mass, it could be cancer, a nodule, it could be infection, it can be infiltrate, it can be lots of different things. Okay? And how do we figure out what it is? History, physical, that gives us a good idea. What it looks like, when we talk about some of these things, what they actually look like. So I already drew this picture, and mine's way better, right? Here's the lateral. Very confusing, I get it. It's not, it's easy. So, if I get atelectasis, what is atelectasis? It's a lung that's not fully expanded, okay? There's no air between the pleural sacs. It's just that if I close off a bronchial tube or a small one, I don't aerate the alveoli and they collapse. And what can do that? A mass, an infection that's really, really bad. But atelectasis is that lung is collapsed in. So, an example of a right upper lobe that has collapsed. What's going to happen to this side of my diaphragm? It's going to pull way up, right? So my right diaphragm is going to be a lot higher, okay? And you're going to see a consolidation up here. It's going to be, remember how it's supposed to be blacker up here? This is going to be really white because it's fluid, it's infection, it's fluid. And you'll probably see a fissure. Do you normally see a fissure on the chest x-ray? No, because there's no fluid sitting in there. So what you've got here is a significant collapse of the right upper lobe. And it's shifted up. Not shifted a lot, but we know that that's definitely a right upper lobe. Because that fissure should be straight across in reality, but it's shifted. All right? So right middle lobe, atelectasis, or something's in the right. My margin, you know how you can see that just real clear. You can see the right heart margin. This very nice sharp line. In this picture, you can't really distinguish it. That's called the silhouette sign. Loss of the silhouette sign. So there's something sitting here that I can't distinguish this. not a sharp margin, not a sharp margin. I confirm that it's in that right middle lobe by looking at my lateral and going, well, of course it's right there in my middle lobe, because that's where my middle lobe is. So you see this density, this white, it's in my middle lobe. You guys see that? There should not be this white area, so that's in your middle lobe. This is the silhouette sign, or no, silhouette sign. I do not see the right side of my heart. Now, I actually see a little bit of blurring or loss of my cardiac angle here too. So could it be the lower lobe too? It could be. So I look at my lateral and I see, it's my middle lobe. Because it's sitting right in that middle lobe. Okay? Brilliant. Wow. Okay? If you look right and left, this side is darker and this side is lighter. And we get a little bit of blurring of this side. It's not as bad as the other one, but we know that this is whiter over here. It's whiter. White. This side looks black, this side looks whiter. And there's a little bit here of blurring. So when I look at my lateral, that's why they're so important to look at both, I can see that there is actually something going in that on that middle lobe. So, yes, I've lost my right heart margin, but I've also lost my diaphragm here. So, I'm not sure exactly where it's at. Remember, I gave you guidelines, but they're not 100% because I have something that's three-dimensional. So I have to use my lateral and I go, yeah, the cardiac, there's no whiteness here, that looks really good. But remember how this is supposed to get blacker and blacker and blacker? Here is the density right here. That's in my right lower lobe. So vertebral body should get blacker, 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 blacker as you go down. And there's something white sitting right there. Here's some streaking that's coming down. A little bit of loss right here, a little bit. I didn't do a chest x-ray just out of the blue. This person came in coughing, didn't feel good, right? But I always have to look at my lateral. And what happened to the vertebral body here? Did they get blacker, blacker, and the blackness gets more black? I don't know how to say that, but is it more black going down? No, this white right here, there's infection right there. So definitely look right to left. You know looks like something's here because it's whiter compared to this side. And then look at your lateral and say, where the heck is this? Oh, my right lower lobe. Do I need a history here a little bit? Well, of course. I didn't just order an x-ray on you for no darn reason. Okay? So there's something going on here. Definitely lost my margin here. This is a bad x-ray, but it is what I got. So definitely lost my margin here, okay? Left upper lobe. Okay, the aortic notch or knuckle, I don't care, they're both acceptable terms. But the aortic notch. So I've lost the notch, I'm not sure, something is covered up here. It's wider right to left. It's wider right to left. I look at my lateral and there's, remember, that fissure should be right here between my upper and lower lobes, and it's all the way up here. So something has shifted, has collapsed that lobe of that lung. So it's right here, the upper lobe is now right here, here. In fact, I lost really that dark, remember, anterior to the heart should be blacker. That's really gone, because that lung is collapsed. So I'm looking for my heart margin here, the left heart margin, the left ventricle. It's not there. So something is, I've lost that nice sharp margin. So something's sitting in front of it or behind it or something. Then I look on my lateral, and here is this density right here. That's nice and dark here. It's definitely dark here. Looks good. Definitely loss of my margin here. Okay, and then you see this darkness, this density or opacity. Okay. Left lower lobe, I don't know where my diaphragm really is. Something's going on here. And then you can see actually that this is actually a bad picture. Let's go to this one. So we've lost the diaphragm here. Where is the diaphragm? Here's my this is a great gastric air bubble right here. See this? That's a gastric air bubble. That's air fluid. But I don't know where the diaphragm is here. Is that a rib? Is that the diaphragm? I can see the heart margin really great, but I don't know what's here. I look on my lateral and I've lost. The vertebral body's getting blacker and blacker and blacker. Something's sitting in that left lower lobe. Sitting behind that heart. Okay, where's it at? Just by this. What have I lost? My right heart margin's gone. So probably right middle lobe. Where's it at?
Right middle.
Right. That's correct. The right heart margin is gone. There's a little bit of blurring of the right diaphragm. So you look on the lateral and go, yeah. You actually have middle and lower in this picture. Because look at this. See how the streaking comes down? And what happens to my vertebral bodies? No, you can't even see them really. They're covered up with infiltrate. infection. And there's something going on right here. So we have both a middle and a lower lobe, which happens all the time. Pneumonias don't happen in one lobe. This is a great picture of an upper lobe infiltrate because it's sitting right on the fissure. So the infection or whatever's going on in this picture is just set, it's abutted right up against that middle lobe.
Can you go back one slide?
Yep.
What is that area on their left lower side? That, yeah, where
This?
your mouse is, yeah. Is that just air?
That's the descending colon right here. That's their large colon. So the transverse and descending.
Okay.
That's their liver. It's air trapping actually what ends up happening in those kids. They get a lot of air in there. That's why they get belly pain. That's one of the reasons why kids with pneumonia get belly pain. Is they swallow a lot of air. Part of it.
So how can you tell the difference between that, which would be normal, versus what you're talking about with air under the diaphragm outside?
Right? Because it's a real thin line, okay? The gastric air bubble, you have an air fluid line. So what you have is, this is just, you can see the colon, you can see the hostra and everything, right? You can see it. When you get an air fluid level, you have a real thin area there. Versus, like even on this side, so this is your left side, right? Correct, left side. A gastric air bubble, what it looks like is you have an air fluid level. You have fluid, and then you have air. So this is denser, right? Opacity. And then you have air in this spot right here, so it looks black. So the air fluid level.
So as far as what you're talking about air, the one you said that was really, really bad, if you saw it where there was air right under the diaphragm, that's what it would look like on the left? Or that's what you're saying the colon?
This is the air fluid. So ask me your question, I guess I might answer you.
In the last bunch of slides, you mentioned it's really, really bad if you see air right under the diaphragm. So not the gastric bubble and not the colon.
Right.
How does the air under the diaphragm look different than the colon?
Because the colon right here is, this picture right here, I know it's the colon because you can see that it's a tube. You can actually follow it here. Now, it may cover something up on that side, but the other thing to think about is the right side is usually higher. So most times, air under the diaphragm, you're going to see it on the right side. Okay? But it may be difficult, and your air fluid level versus air into the diaphragm, your air into the diaphragm will be above your air fluid level. Because that's your stomach, right? It's the air fluid level in your stomach. So your air is going to be above that. And there is no air fluid level. So an air fluid level is much different. It's difficult when it looks like this. In fact, it's really difficult to see anything under the diaphragm when they've got all that air trapping in their colon.
So do we read radiographs on exams?
Yes.
I mean, on the next slide?
Yes. You will. So what we're going to do with on Friday is, I know this is all kind of normal stuff, and I've talked a little bit of pathology. What we're going to do is we're going to put some of this pathology with some of the diseases. So we'll talk about pneumonias, and we're going to talk about some of the interstitial stuff that you'll see, what's in the lungs, and like when you do have, like a foreign body, like a valve, when we do different x-rays to look for different things, or why you would put people in different positions because of certain things that have happened, like in pneumothorax. We're gonna look at cancers and different pathology. But the biggest thing is what I want you to do right now is just look at x-rays and understand anatomically and things that you are looking for. Okay, so start looking at some x-rays. We don't have a x-ray bank here, so I can't help you with that, other than just look at them, and if you don't understand it, let me look at it and I'll help you. Okay?
Good job.